Ready, Mike?
Yes.
Okay, so just please state your name and specialty.
So I'm Ben Kittinger. I'm with Plastic and Reconstructive Surgery at Owensboro Health.
And how often are you caring for breast cancer patients?
Sorry. Do you want his badge? I just noticed we've had.
If it's okay, yeah.
Let me take it off.
Just set your
I've
badge.
seen that we've had
Sure.
them off on everybody else. I didn't.
Yeah. And then your tie.
Is it
It's like yeah.
Yeah, now you're perfecter than before.
Okay. Okay.
So what are the goals of a plastic surgeon in dealing with a breast cancer patient?
So I think as far as the plastic surgeon's job, it's mainly to inform our patients who have breast cancer what their options are. We're often seeing patients at a high anxiety moment, and really it's to try to tell them that things are going to be okay. We've got a great team. There's multiple people involved. And from us, it's not can we rebuild the breast, but when should we rebuild the breast? When's the best time for the patient to do that? Often it can be done immediately and safely, treat the cancer at the same time. And mainly it's just to inform patients of our role in treating that patient's breast cancer and also rebuilding the breast, which can really show them more of what they can be in clothing and even out of clothing to look more normal and feel like a woman again, even though they've had this sometimes devastating diagnosis.
Come on through. All right, ladies.
How you doing?
Hey, man.
Hey.
Morning.
Yeah.
Good.
So I think a couple years ago, I don't know where, I was working on the broad A stuff, and we came up with the term that every woman faced with breast cancer has reconstruction options. Is that true?
Absolutely. I think it's really important for us as a organization, and certainly here having a multidisciplinary clinic with all the providers involved, to really highlight the role that every patient really is a candidate for reconstruction. And by reconstruction, it can be something simple like an implant or something more complicated like using a patient's own tissue to rebuild their breast. And having those conversations up front, I think, can really give patients the ability to think about those things and decide on them with plenty of time, and to know that they don't have to make the decision immediately. They can wait and come back several years down the road. Maybe they just want to treat their cancer and be done with that part. We certainly see patients that are 5 and 10 years out from breast cancer who are considering breast cancer reconstruction at that point in time.
So is it ever too late to reconsider reconstruction? Lady that's had double mastectomy or something 20 years ago?
As far as reconstruction goes, there's almost never too late to do anything. We've seen ladies that have had advanced breast cancer with big operations and are left with real big deformities of their chest, and we can still rebuild their breasts and start from scratch even 10 or 15 years down the road or later.
Pull that off, yes. So the Guatemala trip, now is that one that are filling in for?
Mm-hmm.
Have y'all been on that one before?
We have. We've both been before. The organization is called Faith and Practice, and they essentially do exclusively mission trips to this one or two places in Guatemala. They've been doing it for about 15 years or so.
Okay.
So
I think when we had done little videos, B-roll again, not an interview on camera.
yeah.
Back in the fall when we got the President's Award, Lisa Edge was with us, and she's a nurse that works in employee development. And her grandson is from Guatemala, so they had a nice conversation.
Sure.
Maybe even the same area. I'm not sure. But everything good?
Yeah.
Okay. So next we'll talk about the multidisciplinary team and how that helps breast cancer
Okay.
patients. You ready?
Yeah. Sorry, I just had to switch cards.
Oh, no problem. So tell me more about the multidisciplinary team and how that helps breast cancer patients.
So our multidisciplinary team of providers here at Owensboro Health is really special. It's great to have everyone sit down and get involved with the care of each patient. We do that twice a month, so there's never a time where there's any lapse as far as treatment of patients. Often what happens is one of the providers that sees a patient first will talk about that patient, their history. We'll get everyone's in-depth analysis of their problem, from the radiologist to the pathologist to the general surgeon and the hematology oncologist. We have our breast cancer navigator there who's making sure that all those appointments are coordinated. So really we're using everyone's expertise at the same time to highlight what we can do for patients. And breast reconstruction is a part of that conversation as well, what we can do immediately or what we need to do to wait to rebuild someone's breast.
You're fine. Big old chair here. Next, we'll have to talk about how breast cancer care has changed over the last 20, 25 years. I didn't hear of Reconstruction until, I don't know, as recently as 5 years ago.
Yeah,
I
yeah.
didn't know anybody that was intimately involved.
Right.
So how has breast cancer care changed, especially for you in the last, or your discipline in the last 20 years or so?
I think breast cancer care, especially for breast reconstruction, has changed pretty dramatically. The old focus for breast reconstruction was really on implants only, and that's a foreign device we put in to really model the shape of a breast. And what we can provide to patients these days is a little bit different. There's been advances as far as replacing tissue or volume or having small defects in the contour of the breast that we can replace just with using something called fat injections or fat grafting. That's a relatively new development that we're really using in breast cancer patients to really highlight and disguise what can otherwise be disfiguring deformities of the breast.
Come on through.
Sorry.
No problem.
We did find ourselves in a hallway. Yeah. My call. I got one more thing. So next I'll ask if you could say 2 positive things to breast cancer patients that would get care here. What would you say? She's going to beat the number. Ready? So if you could say 2 positive things to a breast cancer patient that get care at Owensboro Health, what would you say?
I think 2 things that are probably the most positive about the experience that we can provide patients here is you don't need to go to a major medical center. We have all the specialists here. They're fully trained. They're more than competent to take care of your cancer right here. If you leave 2 or 3 hours away and don't want to travel to a major large city or just live here in town, I think we have the capabilities, the expertise, and the up-to-date cancer treatments to easily treat a breast cancer as aggressively as we need to. The other positive thing I think we can say, particularly about my practice, is I work with my wife. She's another plastic surgeon. When I work on patients who have breast cancer and doing breast cancer reconstruction, we can offer things that most other practices can't. Our operations usually go much quicker. Patients have faster recovery times. Another set of eyes and ears listening to patients and figuring out what they want is really important to us as we take care of this patients with breast cancer.
That's got to be a really special situation from just feeling good at the end of the day. I had never thought the fact that you would, on occasion or regularly, be standing beside each other helping take care of somebody.
Yeah, the relationship with my wife really helps out in the operating room and in the clinic. We can really see each other's patients, bounce ideas off of each other, and usually give patients, I think, a better outcome because of our relationship both at work and at home.
That's awesome. Do you have a personal story of someone you know or love who's been faced with a breast cancer diagnosis?
So I think with the practice of breast reconstruction, it gets very personal almost with every patient. But certainly we've had ladies that have had major surgery. Sure.
Just yesterday, all the UL students, whatever, they all have a bag of rolling. For some reason, right? Sorry, so back on, do you have a personal story? Someone you know or love has had a breast cancer diagnosis?
Yeah, so I think one of the best parts about taking care of breast cancer patients is we really do develop a lifelong relationship with each and every patient we see. We tell patients that this breast cancer reconstruction is a process. It's usually not one surgery where you're one and done, but it's usually several procedures, sometimes bigger ones, sometimes smaller ones. And so we really do develop a personal bond with our patients. We enjoy seeing them. They get to be friends and almost like family with the office of our staff in the clinic. And every patient we usually develop a pretty firm bond with because they're used to seeing us and going through this process with us.
Excuse me, come on through, sir. And next, I ask you, what's your personal philosophy in caring for breast cancer patients? Hang on one And are you familiar with the American College of Surgeons National Accreditation Program for breast center?
Mm-mm.
That's fine. And then, do you have any benefit from the UK American Cancer Center affiliation, or is that just something you know a little
I think
about?
I know a little bit about it. I mean, I think the hematology oncologist and probably the general surgeon would be more into that because usually it's just enrolling in cancer trials
Right. I
for
knew they were-
specific regimens of chemotherapy.
Each other too. Just more folks coming in. And then we're almost done. Anything else you want to add to
I'll talk a little bit about our tissue-based reconstruction. It's not done on a very wide national scale.
Okay. Special, yeah, special.
Mhm.
Okay. And when you're ready, go ahead and jump into that.
I think one of the greatest things that we can provide here at Owensboro Health is we really do provide all the options for reconstructive surgery for patients with breast cancer. What that means is about 90 to 95% of patients that get breast reconstruction get that with an implant. Every patient should be treated individually, and certainly implants are the right option for many patients. However, with what we have here at this hospital, we are able to offer patients reconstruction using their own tissues. What that is like having a free tissue transplant, most often from the abdomen, where we'll harvest a large piece of skin and the underlying fat and transfer that up to the breast, reshape and remake and rebuild the breast with that tissue. That tissue is the patient's own healthy tissue. It's warm. It can even regain sensation.
So that's how long have y'all been doing that, or how long is that?
Since my wife got here.
Okay.
Yeah.
Okay.
So we've been doing that for the last 4 years. We've treated probably up to 100 patients with this type of surgery. It's very safe. It's very effective.
Do you have less problems because it is their own tissue, their body's used to?
Absolutely. Absolutely. Because it's their own tissue, you really don't run into any problems like you can with implants. Anytime we put an implant, we tell patients it's kind of lifelong maintenance. With using your own tissue, it behaves and acts just like your own normal tissue. If it heals in, it stays with you for life. It acts just like your normal tissues.
Come on through. And we'll just ask, what's your personal philosophy in care for breast cancer patients? Anything else you want to complete?
I don't think so.
Behind her. Well, how is your Guatemala trip set up for you? You guys just show up and everything's arranged, or you have to?
Pretty much. The logistics of the team that sets everything up is very impressive. Often you'll see 40 or 50 patients on the Sunday before the week starts to kind of plan the who to operate on and when.
Great. Come on through.
And they're highly focused on safety, which is probably the most important part, both of the patients they're taking care of and all the volunteers that are there.
Is it larger cleft palate or other things as well?
It can be, but it's a little bit of everything. In fact, they usually tailor that based on the people that are coming down. So I mean, there's orthopedics that comes down there, general surgery, OBGYN.
Okay.
There's just
Spectrum of whoever
there's
shows
pure
up.
primary care teams that go to kind
Come
of
through.
villages.
Take your time.
And then there's plastic surgeons too, ENTs. I mean, they kind of take a wide
Okay.
spectrum to try to treat the whole population.
Not just
But ours has usually been more cleft lip and palate patients.
how big of a geographic area do they pull from?
The whole country.
Yeah.
And it's not a big country, but it's 10 or 12 hours by bus to get to some corners
Yeah,
that you
sure.
think are just like
Mhm.
90 miles away.
It's not a road like Frederick Street or anything.
Exactly.
Faith in action? is that what it is?
Faith and practice.
Faith in practice. I'll look that up a little bit and
Okay.
get back with you on that. And then lastly, just tell me your personal philosophy in caring for a breast cancer patient.
So when I'm taking care of a breast cancer patient, I think one of the biggest goals I can have is try to identify the expectations and concerns a patient has about their diagnosis, and then for me to try to educate them on what we can safely do and usually easily do with a series and steps of surgery. And usually after several conversations, it's easy to really individualize patient care to what each individual person needs. An operation that works for one patient certainly may not be the right operation for another person. And usually we can discover what patients require, what they want, what they need, with several visits and several conversations, educating the patient on what their options are.
So since you have a number of interactions with a patient that has reconstruction, at the emotional end of that, even though they may see you throughout the years, what does that feel like as a practitioner to know you've given someone their confidence back, for lack of a better term?
Yeah, I think when patients come back after the breast reconstruction process, how satisfied they are with their body image, psychologically, their emotional well-being is usually significantly improved. And that can be a very special thing, to have a relationship with a patient who really gets rebuilt and is happy and is smiling, is going out in their community again, participating, even at work. It's a really special bond we get to have with our patients here. We often tell patients that this can be a devastating diagnosis, but when you come to our clinic, this is kind of like the happy place. We're going to talk about things to make you whole again and to rebuild you and reshape your life.
That's fantastic. Thank you. I had a son that had...
Don't stand up in, just want to get this out of your way. So
Sure.
Poke your eye out.
Yeah.
I had a son that had cancer. He was at St. Jude's 4 years ago.